The colon is the large bowel or large intestine. The rectum is the last part of the large bowel, also part of the colon. Colorectal cancer is a cancer that occurs in the colon or the rectum. Healthy cells in the colon grow and divide normally in a controlled way to keep our bodies healthy. When these cells are damaged, they can continue to grow beyond control even when our body does not need new cells. These cells can then invade through the colon and into surrounding organs, or go through the bloodstream to more distant organs and destroy these organs. Colorectal cancer is one of the 4 most common kinds of cancer worldwide, and it is the 3rd leading cancer killer worldwide. Colorectal cancer affects 1.4 million people yearly around the world and results in 700,000 deaths every year. If we were to take the United States as an example, colon cancer is the 2nd leading cancer killer after lung cancer only. We don't know what causes most colon cancers. However, we do know that most colon cancers start as colon polyps. Polyps are abnormal growths that occur in the lining of the colon and are initially benign, but can later become cancerous in some cases. Men and women are affected by colon cancer almost equally. The risk increases with age, and it is most commonly seen in people over the age of 50. Risk factors for colon cancer include a family history of colon cancer, certain inflammatory conditions of the colon, such as ulcerative colitis or Crohn's disease, and, to a lesser degree, obesity, a sedentary lifestyle, smoking, alcohol, and a diet that is low in fiber and high in animal fat and red meat. Colon polyps and most early colon cancers do not cause any symptoms, and this highlights the importance of screening exams because these are the stages when the cancer is curable or even preventable. Most advanced colon cancers can cause blood in the stools, a change in bowel habits, abdominal distension, persistent abdominal pain, or even weight loss. Diets that are high in fiber and low in red meat, processed meats, and fat have been linked to a lower risk of colorectal cancer. Exercise, physical activity, and maintaining a healthy weight are also thought to decrease one's risk. Avoiding smoking and limiting alcohol intake is also recommended, but the most important way that you can decrease your risk of colon cancer is by getting screened. Screening has been clearly shown to save lives. Up to 80% of colorectal cancers could be cured or even prevented by screening. Undergoing a screening exam, meaning an exam when you have no symptoms, is so important because of the fact that most early colorectal cancers and polyps do not cause symptoms, and it is specifically at these early stages when colorectal cancer can be cured or prevented. We typically start screening for colorectal cancer at age 50 for average risk patients, or earlier if there's a family history of colorectal cancer. There are several screening tests available, including stool studies for either microscopic blood in the stool or abnormal DNA, both of which would be thought to originate from the cancer. Some imaging studies can be performed, including CT colonography, also known as virtual colonoscopy, and this involves radiologic imaging of the colon with a CT scan after inflating the colon with air. And of course, colonoscopy, which is our most accurate test, and it involves inserting a small tube with a camera into the colon after giving patients a gentle intravenous sedative. The advantage of colonoscopy over the other tests is the ability to remove polyps once they are diagnosed, so it is both a diagnostic and a therapeutic exam at the same time. Each of these tests has its advantages and disadvantages, and your doctor can review all of these options with you. But remember, any screening test is better than no screening test at all.